I get asked all the time what sets these two BPH treatments apart, UroLift or Rezum. Today, I'm going to walk you through the facts on both options for an enlarged prostate. I'm Dr. Rena, a urologist and pelvic surgeon. If you're new here, I share weekly videos every day covering urologic health, sexual health, bladder health, and much more. Let's begin with the basics. Benign prostatic hyperplasia, or BPH, is a condition where the prostate becomes enlarged. Around 50 to 70% of men over the age of 50 experience some urinary symptoms related to BPH. These can include trouble fully emptying the bladder, hesitation before the urine stream begins, a stream that starts and stops, feeling like the bladder isn't completely empty, waking up often at night, needing to go to the bathroom frequently, or having a strong urge that's hard to hold. Many men choose medication as their treatment. However, studies show that about 70% of people either stop taking these medications or don't take them consistently, often because they don't feel they work well enough or due to unwanted side effects. At the same time, many of these men prefer to avoid surgery. They may not want a hospital stay, anesthesia, or a long recovery period. In particular, they're concerned about side effects, especially ejaculatory dysfunction. This means that during ejaculation, some surgical procedures can lead to little or no semen being released, with some of it flowing backward into the bladder, known as retrograde ejaculation. This can occur in up to 20% of patients, depending on the type of surgery performed. That's where these two treatments come into play. They're known as minimally invasive therapies. While many people recognize them as UroLift or Rezum, names given by the companies, the medical terms are prostatic urethral lift and convective water vapor therapy. To start, let me give you a brief overview of each option. One of the biggest advantages of both treatments is that they are usually performed right in the doctor's office and often without anesthesia. This means you can have the procedure done quickly and efficiently, then go home the same day without needing to stay overnight in a hospital. Convective water vapor therapy works by delivering controlled, targeted, sterile water vapor directly into the prostate tissue. This causes the prostate cells to essentially break down and die, leading the tissue to gradually shrink or disappear. One of the key advantages of this therapy is that it stays very focused on the prostate itself. It does not harm nearby structures such as the bladder neck, the urinary sphincter, which helps keep urine in the bladder, or the outer capsule of the prostate, where the nerves responsible for erectile function are located. During the procedure, a specialized cystoscopic camera is gently inserted into the urethra. Through this, a small delivery tool is guided into the prostate. With direct visualization the entire time, we can clearly see what we're doing as the device releases water vapor for about 9 seconds per treatment. Depending on the size of the prostate, most patients receive around 4 to 6 treatments in a single session. After the procedure, most individuals will need a catheter for about 2 to 5 days to allow proper healing. This treatment is generally recommended for men with a prostate size between 30 and 80 grams. When you visit your urologist for evaluation, we determine prostate size using a few different methods. This may include a digital rectal exam, a cystoscopic view using a camera, or a transrectal ultrasound to measure the prostate more precisely. To evaluate how well this treatment works, a multi-center study was conducted across several locations in the United States, involving men with BPH and related symptoms. Participants were randomly assigned to either receive the water vapor therapy or a sham procedure. In the sham group, a cystoscope was inserted without delivering the treatment, meaning no water vapor was actually applied to the prostate. Researchers then measured improvements in both quality of life and symptoms using validated questionnaires, along with something called a flow rate test. When you visit a urologist, you may be asked to urinate into a specialized device known as a UroFlow machine. This tool measures how quickly urine is released, giving us an idea of whether there may be a blockage or reduced flow. While it doesn't tell us the exact cause, it does show if your flow is below normal. It's commonly used to monitor BPH patients and track progress over time. Across all these measures, questionnaires, and UroFlow testing, patients showed improvement lasting up to 5 years, with results ranging from about 44 to 48%. On average, the procedure itself took around 5.3 minutes to complete. So it's a very quick procedure. They also looked at surgical retreatment rates. What does that mean? It refers to whether someone needed another procedure because the first one didn't provide enough relief. What they found was that about 4.4% of patients required some type of additional surgical treatment. Some patients experienced discomfort during urination, which occurred in roughly 17% of cases. Blood in the urine was also noted, which is quite common, along with blood in the semen. Increased urinary frequency and some difficulty urinating after the catheter was removed occurred in a small group, about 5%. A decrease in ejaculatory volume was also reported in around 5% of patients, so it affected only a small portion overall. On the other hand, the prostatic urethral lift works in a different way. Instead of removing or destroying tissue, it lifts and holds the prostate tissue in place. This is done using tiny anchors and a suture placed across the prostate, which pulls the tissue back to create a wider channel for urine to pass more easily. It's also recommended for men with prostate sizes between 30 and 80 grams, as long as their anatomy is suitable for the procedure. This approach was also studied over 5 years in about 200 patients across 18 centers. Participants were again randomized, meaning that for every 2 patients who received the prostatic urethral lift, 1 patient underwent a sham procedure, a similar setup without the actual treatment. During the procedure, a specialized camera is inserted into the urethra, allowing the physician to place the anchors and stretch the suture across the prostate before securing it. It's usually performed using numbing gel and lubricant. Afterward, some patients can go home without a catheter, while others may need one for a day or 2, depending on the prostate size and the number of implants used. Just like in the water vapor study, researchers evaluated symptom improvement, urinary flow, and overall quality of life using validated questionnaires. Results showed improvements lasting up to 5 years, ranging from about 36 to 52%. However, the surgical retreatment rate, meaning those who needed another procedure, was higher at around 13.6% over 5 years. The side effects were similar to those seen with water vapor therapy. However, one key difference is that this procedure showed no cases of ejaculatory dysfunction and no impact on erectile function after treatment.